Hello, my name is Lester Willis and I am a DNP student at Brandman University. And the following is a presentation about Ida Jean Orlando Pelletier and her nursing process discipline theory. Miss Orlando Pelletier was a first-generation Italian-American, born in 1926. She received her nursing diploma from New York Medical College in 1947. She earned her Bachelor of Science degree in Public Health Nursing at St. John's University in Brooklyn, New York in 1951, and her Master's degree in Mental Health Nursing at Teachers College, Columbia University in New York in 1954. Afterwards, she served as an associate professor and the director of the graduate program in mental health psychiatric nursing at Yale University from 1954 to 1961. During her time at Yale, Miss Orlando Pelletier received a research grant from the National Institute of Mental Health to study the integration of mental health concepts in basic nursing curriculum. She was the first psychiatric nurse in the U.S. to obtain an applied research grant from the National Institute of Mental Health and served as the principal investigator. This initial research would lead her to publish her first work in 1961, The Dynamic Nurse-Patient Relationship, Function, Process, and Principles, and it laid the foundation for her theory, the nursing process discipline theory. She would go on to publish The Discipline and Teaching of Nursing Process, an evaluative study, in 1972, and then republish The Dynamic Nurse-Patient Relationship in 1990. Theory development process. The theory was first developed from research and published in 1961 and would continue to develop through Miss Orlando Pelletier's career. Theory development followed the practice theory strategy of creation, where theory originates from clinical experience, case studies, and observation. With or without existing theory as a guide, concepts are developed, defined, given limits, and described in examples. Miss Orlando Pelletier was inspired by her dissatisfaction of nursing care being driven by physicians' orders and organizational policy. She believed that nursing is a unique discipline and that licensure gives nurses the authority to work independently from medicine. Additionally, she believed that nurses are accountable directly to the individuals that are receiving care, and she sought to uncover a theory of effective nursing practice. Through her study of approximately 2,000 recorded nurse-patient interactions, she was able to link the concept of effective nursing care to the concept of validated patient need, which she coined as a deliberative process, as opposed to the automatic processes of orders and policy. An effective intervention improved patient behavior by meeting the patient need. From this study, Miss Orlando Pelletier found three areas of concern for the profession of nursing: the nurse-patient relationship, the nurse's professional role, and the identity and development of knowledge that is distinct to nursing. At this point, Miss Orlando Pelletier moved forward in her next experience to apply and test her theory and build upon what she had learned. She became a nurse consultant at McLean Hospital in Belmont, Massachusetts in 1962 and consulted in the use of deliberative nursing practice. Nursing instructors taught deliberative nursing process at McLean School of Nursing, Children's Hospital, Massachusetts General Hospital, and Peter Bent Brigham Hospital. Research conducted at McLean Hospital resulted in the Discipline and Teaching of Nursing Process, an evaluative study published in 1972 in which the deliberative nursing process was renamed as a nursing process discipline, continuing to emphasize the importance of the deliberative nursing actions, consciously identifying, validating, and responding to a patient's needs in the nurse-patient interaction. She stressed the importance of nurses being instructed in a manner that brought about disciplined and professional care practices. Nursing education was said to change the responsiveness of the nurse from one described as personal and automatic to one that is disciplined and professional. After completing the 1972 publication, Miss Orlando Pelletier moved on to Metropolitan State Hospital in Waltham, Massachusetts to apply and test her theory in a state psychiatric institutional setting. She republished her original work, The Dynamic Nurse-Patient Relationship, Function, Process, and Principle, in 1990 and remained at Metropolitan State Hospital until its closure in 1992. The Nursing Process Discipline Theory of 1990. Miss Orlando Pelletier's updated work presented application of the theory as an enhanced nursing process that requires a more comprehensive interactive relationship within the nurse-patient encounter. This process was described as reflective and circular as opposed to linear. Nursing is described as an interpersonal process that meets the patient's immediate need. This interpersonal process, the nursing situation, consists of the patient's behavior, the nurse's reaction, and the nursing action appropriate to the person's need. Essential nursing activities include automatic and deliberative responses. Automatic nursing processes are those without discipline and include physician's orders, general health routines, and interventions that are not specific to any particular profession or discipline. While these processes may not necessarily be wrong, they alone would not meet the need of the patient. Deliberative nursing processes were also needed to meet the patient's need. These are nurse-initiated processes that assess how the patient is affected by the nurse, or in other words, how the patient responds to care. These activities include instructions, suggestions, directions, explanations, information, requests, and/or questions that assist in identifying and caring for the need. This also includes making decisions for the patient or changing the patient's immediate environment. Deliberative processes can occur directly when a nurse's action meets a need that a patient could not meet for themselves, or indirectly when the nurse refers the patient to where that need can be met. A deliberative process was presented as a guide for nurses to practice effectively. An automatic process was ineffective, and effectiveness was conceptualized and illustrated as improvement in patient's behavior. The improvement stemmed from the fact that the deliberative process made it possible for the nurse to identify and meet the patient's need for help. The process is deliberative because the nurse must employ deliberation in order to determine the need and to determine whether the decided upon action met the need. Focus is on the whole patient rather than the disease or the institutional demand. Nursing process discipline was said to improve nurses' decision-making skills, provided for more effective resolution of staff and physician conflicts, and promoted a more positive nursing identity and unity. This next section will look deeper into the theory and its components. The meta-paradigm of nursing includes the four components of person, nursing, health, and environment. In nursing process discipline theory, a person is viewed as a behaving human organism. Nursing is an interaction with a patient that has a need, and that interaction involves validation, not only of the need, but also of the effect of care in order to improve the patient's health. Health is mental and physical comfort, a sense of adequacy and well-being. Environment is the time and place of the nurse-patient interaction, the context of the nursing situation. When you look at the holarchy of this situation-relating middle-range theory, it is of an interactional paradigm, emphasizing the relationships between people and their roles, the nurse and the patient. The interaction and the results of it can be decided by the roles that each play, with the nurse reacting to the patient's interaction, the patient reacting to the nurse, each altering their response to each other. This interaction, and the interaction with the environment as well, describes the philosophy of a reciprocal interaction worldview founded in simultaneity. While a conceptual model to guide the theory creation was not found in literature, one could assume that a conceptual model of an interpersonal relations framework would fit nicely, as Orlando's work was influenced by another middle-range theory, Peplau's interpersonal relations theory, which was developed from Harry Stack Sullivan's work on interpersonal relations. As mentioned earlier, a practice theory creation may or may not be guided by an existing theory. The nurse process discipline theory is a predictive middle-range theory. It is knowledge confirming and predicts cause and effect relationships. Constructs include nursing process, automatic and deliberative processes, and concepts include nurse-patient interaction, validation, patient need, deliberation, professional disciplined response, and patient improvement. Nursing process discipline theory as a model. As a schematic model, one can see that the nurse-patient interaction begins with assessment of the patient's behavior. The nurse identifies their own thoughts and feelings in the interpretation of the patient's behavior and validates their thoughts and feelings about the behavior with the patient. If their thoughts are inaccurate, the nurse then reconsiders their interpretation, their thoughts and their feelings. If the nurse's thoughts are accurate, then they formulate measures to meet the patient's need. Afterwards, they check the patient's response for an improvement of distress or behavior. If the nurse's actions do not improve behavior or relieve distress, the nurse then checks back with the patient to further validate and formulate additional action. When the patient improves in behavior or validates relief of distress, the deliberative process has been effective. I will now share an example of nursing process discipline theory in practice entitled Gold in My Shoes. A call was received regarding a patient who was being non-cooperative and was agitated. The patient would not follow staff direction to adhere to the unit routine, which required that he leave the unit to line up with the other patients and walk down to the dining room. In his refusal and in his agitation, the patient kept repeating, "I have gold in my shoes." Going by automatic processes, the staff initially perceived the patient as psychotic, defiant, tense, angry, and potentially assaultive. The action for these findings would have included further restricting the patient's ability to access services independently due to his behavior, and, based on physician's orders, giving the patient medication for psychotic symptoms and agitation. These actions would not have addressed the patient's need. Employing the deliberative process, the nurse initiated an interaction and asked a series of questions aimed at the patient's verbalization of "gold in my shoes" to gain a better understanding of the patient's need. Does the gold hurt you when you walk? Can I see the gold? As it turned out, the patient's feet had multiple calluses, some of which had torn. He was referring to the distress this was causing as "gold in my shoes." The nurse provided direct measures in the form of first aid, cleansing the patient's feet and bandaging them. The nurse then ordered for the meals to be delivered to the unit and arranged for indirect measures a referral to podiatry, and an appointment for properly fitted shoes that would minimize the friction that caused the calluses to tear. Afterward, the patient was not experiencing distress. His agitation subsided and he was capable of cooperation, as the staff directions were not causing him pain. His needs had been met, and the patient improved. Thank you for taking the time to view this presentation. I hope that you found it informative and relevant to your own professional nursing practice.